أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. We seek refuge in Allah from the accursed shaitan. Bismillahir Rahmanir Rahim. In the name of Allah, most merciful, especially merciful. Subhanaka la ilma lana illa ma 'allamtana. Glory be to you, O Allah. There is no knowledge for us except that which you teach us. Allahumma 'allimna ma yanfa'una. O Allah, teach us that which will be beneficial for us. Wazidna ilma, and increase us in knowledge. Warzuqna fahma. Ya muqallib al-qulub, O change of hearts. Thabbit qulubana ala dinik. Keep our hearts firm on your deen. Allahumma ja'al a'malana khalisatan liwajhik. O Allah, grant our actions to be done sincerely for your sake. Wa la taj'al fiha haddan li in them a portion for other than you. Ameen. So before we start, I just have a quick announcement of now the course that we have coming up. Okay, my order is back. Okay, so we just have a short announcement before we start tonight's webinar. So we will be having a course on daily du'as. We call it for beginners, but it's just really for anyone who is wanting to know about the du'as that we need to know on a daily basis. So, you know, you're waking up and going to sleep and everything in between. So that will be facilitated by Maulana Zakaria Hanukkah, and it will be from the 16th of Feb up until the 16th of March, inshallah. So it'll be 5 weeks on Thursday evenings from 8 o'clock to 9 o'clock p.m. South African time. So do register for that if you are interested in learning the du'as and learning, the meanings of them and everything that goes along with with learning the etiquette of du'as and how to make du'a and what du'as to make, all of those wonderful things. And we will now be moving on to introducing tonight's webinar, which is on an introduction to insomnia by Dr. Feroza Arbee. She is a psychiatrist who runs a private practice. Her interest is in women's mental health, and that interest started from childhood, and she's fascinated by cultural influences on the presentation of mental illness, treatment, and social perceptions. Dr. Feroza advocates social awareness and destigmatization of mental illness, especially in the Indian Muslim community. So we would like to warmly welcome and heartily thank Dr. Feroza Arbee for making the time to be with us today and share her knowledge and expertise and time with us. So I'll hand over to her.
Jazakallah, Sister Wasfia. Wa alaikum salam, and Jazakallah as usual for having me. It's always an honor. I'm going to go straight into the talk. I know it's Sunday night and it may have been a long week for most of you. So the talk is on insomnia. And I know this is quite a hot topic. So if there's any questions, please put them in the chat and I'll address them as we go along, or rather at the end of the talk. So I'm quite a fan of memes. So I've added a few memes just to make the talk a little bit exciting. But this is one of my kids' favorites, or rather it used to be. This is SpongeBob, and he's always strikes me as being more a character who has ADHD, and obviously with that, the insomnia as well. So firstly, into the basics. What is insomnia? It is when it's hard to fall asleep, takes you an excessive amount of time to fall off to sleep, or it's hard to stay asleep, or if you wake up in the middle of the night or in the early hours of the morning and struggle to go back to sleep. It is the most common sleep disorder, and it's usually quite self-diagnosable. People are good at figuring out whether they have insomnia. And it's nowadays with the internet, there's everything online, so you can go online and do a questionnaire or a sleep study and figure out if you have insomnia. It is not sleep deprivation. So sleep deprivation is not having the opportunity to sleep. So if you're only getting to bed at 1 a.m. and your alarm goes off at 4 a.m., that's not insomnia. That's just not having sufficient opportunity to sleep. It affects daytime functioning. So having fatigue, lack of concentration, headaches, irritability, making mistakes or having accidents. And I'll show you another meme there. Sorry, is everybody not able to see my presentation? Okay, it is visible. There we go. Right. And it usually increases your risk of chronic illness. So people who don't sleep or don't have enough sufficient quality sleep are at higher risk of heart disease, diabetes, and other illnesses, obesity amongst them. Also autoimmune diseases, because if you're not sleeping, your immune system's taking a beating, and then you develop autoimmune symptoms a lot faster. Most adults need about 7 hours per night, but remember, everyone's different. It is said that Margaret Thatcher survived on 4 hours of sleep a night, and she actually didn't need any more. And that was the reason for her productivity. So if you're one of those people who don't get a full 8 hours a night and you're fine, then you don't have insomnia, or you don't have a sleep disorder. It shouldn't be a problem. It's 1 in 3 adults will have some form of insomnia in their lives. I find this number a little bit on the low side. I think actually, for me, the number is probably more like 3 in 4 adults will have some form of insomnia in their lives. Sorry, I'm just trying to go to the next slide. So I just put in a few memes for some laughs. This is a nice one, throwback to my last decent night's sleep, though babies sleep terribly, so I don't know why this would be appropriate. This is probably more like it. All right, so what causes sleep? Bad sleep habits. So when most people come and say, I have insomnia, and we ask a few questions around sleeping habits, we realize most people just have really bad sleep habits. Other factors that cause insomnia: depression, stress, anxiety, a lack of exercise. You can't be sitting at your table or your chair the whole day and then not doing anything and then complain that you're not sleeping at night. Having chronic illness, like we mentioned, cardiac issues, metabolic syndrome, hypertension, having had a stroke, having had dementia, these all lead to insomnia. Restless legs. So I know many patients will come and complain that they seem to be very restless at night, legs jerk for no reason, and that wakes them up. Certain medications can also cause insomnia. And then other risk factors. So older people generally need less sleep, or their sleep patterns go out the window when you're traveling, especially if you're traveling over time zones. People who are overweight, and other people who have ENT issues, so either having blocked sinuses, blocked nose, or obstructive sleep apnea. So obstructive sleep apnea happens when your tongue falls into the back of your throat and you're actually unable to get enough oxygen in. And the snoring is a dead giveaway for that, though you can have obstructive sleep apnea without snoring. And what happens is you actually have a buildup of carbon dioxide, and an alarm goes off in your brain. And that's why the people who are snoring often stop, sort of jerk while they're snoring, and wake themselves up, because their brains are telling them that the accumulation of carbon monoxide can actually be fatal. All right. So this is a typical patient I get, comes in and says to me, Doc, I'm not sleeping. There's so many things wrong with this picture, and I'm going to go through them in a bit, but that for me is this is, for me, just shouts that this is not really an insomnia. This person got the TV on, has had a large meal, has got the remote on his stomach, and has fallen asleep in quite an uncomfortable position. And they'll often say, but I can sleep fine on the couch, but when I go to bed, I'm not sleeping properly. So if you're doing any of these things, I'm going to tell you where to start fixing the problems instead of going to see your doctor. So what can you try at home? Self-care. So obviously that picture I showed you just now of that guy, that's not something you shouldn't be doing that. Improve your sleep habits. It's called sleep hygiene. It's got nothing to do with cleanliness. It is really just putting yourself in the best position to sleep well every night. So most of you know all of these, and we underestimate how much effect these can have. So cut your caffeine intake. Coffee, if you're a person who drinks a lot of coffee during the day, please stop, or rather have your last cup by 4 p.m. Cut down to maybe, depending on how much you've got drinking now, by 50% first, and then further if you need to. Many ladies come to me and tell me they're drinking green tea. Fabulous. It's great for weight loss, great for metabolism, but it's awful for anxiety and terrible for insomnia. It's got a lot of caffeine in it. Gym supplements, if it's got any kind of stimulant in it, it's probably aggravating insomnia. Weight loss products. So those things you buy off the internet, the secret this and that and whatever else, it's got stimulant in it. So if you're seeing yourself having high levels of anxiety or insomnia and you've recently started something, please stop. The same thing goes with pre-workout. The men on this group, or even the ladies who use pre-workout, will know if you take pre-workout and you don't go to gym, what you're like. That's a stimulant. So if you want to sleep, please don't take pre-workout or don't work out at night. And then obviously other stimulants like Ritalin or other medications, and alcohol and nicotine as well. are also stimulants. Establish a healthy bedtime routine with a fixed wake-up time. Give yourself about 20 to 30 minutes for winding down. So you can't go to bed and say, I'll sleep when I'm tired, because that may be at 2 a.m., especially if you've got Netflix or a TV in your bedroom, or you're sitting on your phone and browsing TikTok videos. You're not going to sleep, right? So get away from any devices. I'll come to that in a bit. Use your bed only for sleeping and what it's really been made for. So don't be sitting in your bed trying to reply to messages or work on your emails or watch TV. If you've been trying to sleep and after 20 minutes you're not getting there, get out of the bed, go and do something, use the bathroom, have a cup of non-caffeinated tea, and then try and get back to sleep. So it's no point lying there, working yourself up into a state because you're not falling off to sleep. And make your adjustments gradually. So like with a lot of students come to me and say in the holidays they've been sleeping at 1, 2 a.m. Now it's really, really hard to go to bed at 10 p.m. And I see it with my kids as well. So we take about 3 or 4 days, if not a week or so, to adjust. And we do gradual adjustments initially. So half an hour earlier the first 2 nights, and then another half an hour earlier, till eventually they're sleeping at the time that they need to be sleeping. Prioritize your sleep. So it can't be, I need to do this and I need to do that, and I still have so many other things to do. Sleep must be on your to-do list or on your checklist of not negotiables. That is really important. Because if you're sleeping, you're rested, you're thinking clearly, and you're able to do your best the next day. Cut your daytime naps. You can't be having a nap after Fajr for 3 hours and then again a nap in the afternoon for 2 hours and then complaining because you're not getting 8 hours at night. Also, we don't live in a country that has that siesta in the afternoons. If you're one of those lucky few, then factor that into your daytime sleep, into your nighttime hours. If you're getting an hour and a half in the afternoon, don't expect to get 8 hours at night. Your bedroom environment, this is so important. It needs to be comfortable, disruption-free. So you can't be having someone else watching TV while you're trying to sleep or someone else watching videos. You can't be having the brightest light in the house. Have a dim light, comfortable temperature. Use blockout lining or blockout lights if you need to. Blockout lining on your curtains, reduce your noise levels, and have a calming scent if you want that. Just make sure everything is as comfortable as can be, that is conducive to good sleep. Be screen or device free. And the reason for this is it generates blue light. And what blue light does, it tells your brain that it's daytime and it needs to be active and functional. So it causes stimulation of a different kind. And healthy sun exposure, that's also important. And we're so blessed in South Africa, alhamdulillah, we've got such wonderful sunshine. And this is important to regulate our circadian rhythms. And circadian rhythms are our body's natural day and night rhythms. They tell our body when it's nighttime and we need to sleep, and our body when it's daytime and we need to be awake. If you're not getting enough sun, you're not really telling your body that, because you're exposed only to artificial light. Vitamin D is also really important. That's another thing that I test for when patients come to the hospital. And one of the things they complain about is that they're not sleeping so well. The first thing I ask them is if they've had a vitamin D level done. And if they say no, we test one. We find out that vitamin D is almost always low. And why is vitamin D important? Vitamin D is absorbed by the skin. It allows calcium to be absorbed in our gut. If you're not having enough vitamin D, you're not absorbing the calcium that you're eating and drinking. And calcium is so important. It's used by every single cell in our bodies. It's used by our brain, it's used by our heart, it's used by our skeletal muscle, every single thing. So we want enough vitamin D so that we can absorb calcium. Most people will find out they've got calcium deficiencies when they have a fracture in middle or old age, and the doctor tests vitamin D levels and it's really low. And the body just simply takes the calcium that it needs out of your bones. So vitamin D is essential. If you haven't had a vitamin D level done, I suggest the next time you see your GP for any other reason, just have one done. And obviously, exercise is also important, and to eat earlier. So you can't be having a chicken tikka at 10 p.m. and expecting to sleep 30 minutes later. You will experience heartburn and discomfort. So try and eat the heavy meal earlier in the day, and also eat dinner earlier. So I just put in a meme of a kid lifting a car, because that's what pre-workout does to you. It makes you energetic and it stimulates you. How do we treat, sorry, I'm just wondering if I missed a slide here. So we talked about those things. So some of the other things that you can do if you go see a doctor, they'll talk to you about behavior therapy. So behavior therapy is a lot what we've discussed already, but also just trying to take away the negative connotations of not sleeping. So I think sometimes what freaks people out is when they're not sleeping, then they lie there trying to sleep, and then they get more annoyed because they're not sleeping, and then the irritability and anxiety about not sleeping is what's actually making them not sleep. So the first thing that you do when you can see a psychologist, they do cognitive behavior therapy for sleep, where you get rid of those negative assumptions in your head and you try and manage the anxiety around sleep a little bit better. You also improve your stress management for other things that are happening in your life. So for that, we recommend things like meditation, yoga, other relaxation techniques, some useful apps that you can download and use. And this is about the only time I will actually encourage you to use a phone before bed would be to use one of these apps. So you can always listen to the Quran, have a nice Quran app on your phone if you want, or have this Calm, Headspace, Insight Timer, or mindfulness app. You can take the names down from here if you'd like. If you're able to identify possible causes from what we've discussed, you can try and eliminate those or speak to your doctor about them. Acupuncture is also apparently quite good, though I've never had that for sleep specifically. And then supplements that you can use at home. So things like melatonin, you can get this at the Natural Wellness or one of these homeopathic pharmacies. Just make sure there's a minimum of 3 milligrams in there. So melatonin takes about a week or 10 days to start working. What it does, it shifts your body back into a normal, healthy sleep cycle. So it's a supplement. Melatonin is a hormone you already have. So this supplement will supplement your own hormone and try and get you back to achieving healthy sleep by getting deep enough levels of sleep. It's quite useful for people who have jet lag or shift workers who don't have a normal circadian rhythm. Magnesium also quietens the mind and relaxes the muscles, but it needs up to 6 weeks for it to be effective. But you can definitely try magnesium, also very good for your restless legs if you have it. Then you can get glycine or increase your intake of glycine. I can't give you specific names or brands. I don't actually use or prescribe these myself, but it is commonly found in food, protein sources like meat or chicken. You can also get it in vegetables like spinach or kale, and in bananas and kiwis, but you need to have a 3,000 milligram serving. And then there's valerian root, or chamomile tea as well, which is quite popular, and you can get tea bags of these. These are good, healthy things to have at night if you're struggling with sleep and you do need that cup of something. And then lavender, though lavender is not something you should be taking in orally. This is something that you could have stimulating your other senses, like your olfactory or your smelling sense. So that's just a meme telling you or showing you how you need to be calming down if it means to reduce lights, and that's what you need to do, or eliminate noises and other stimulation. What happens if you do all of these things and it's still, there isn't an improvement in your sleep? So you can go to a doctor, your GP, who will refer on if necessary. The GP but then will always look at the possible causes, the common causes, and advocate or advise lifestyle and medication changes. So for example, if you're taking a dose of your medication too late at night, that may be causing insomnia, and they may just change the dose timing. What you can do to help this, you can already do a sleep questionnaire that you can get online, or make a list of your own medication, a list of questions and symptoms for your doctor, and also what you've already tried. Please don't try your grandfather's or your neighbor's benzodiazepines or heavy sleeping medication, because I know that's a popular option. Is I've tried my auntie's Domonoct, or my sister gave me this, or my cousin. Please don't try those things. Medication that's highly addictive and sedative like that in nature has been prescribed by a doctor, knowing more or less what the person's symptoms are, but the individual reasons for prescribing. Don't take somebody else's Schedule 5 or 6 medication. That's really not a habit I would like anyone to be encouraging, or myself to be encouraging it as well. So I talked about cognitive behavioral therapy. There's a lot of it online. There's no need to, your first line or first step of helping yourself should not be going to see a psychiatrist or a psychologist for this. There's a lot you can do by yourself at home. So to modify your negative thoughts or behaviors and emotions associated with sleep habits. And a sleep study may be of some value. This a doctor can order for you, and they link you up with a lot of wires to a machine that monitors your brain electrical activity along with your muscle and cardiac activity while you're asleep. It also tells how long it's taken for you to fall off to sleep and what levels of sleep you've reached. And I was recently giving a talk on Fitbits, because I often get patients who come to me and say, but my Fitbit said I only slept 2 hours last night. Okay, so you may have been quite restless. The Fitbit may not have picked up the deeper levels of sleep, and it's not routinely advised as a reliable sleep monitor, but it can be useful. And remember, Fitbit also, if you're very active or if you're walking around, if you're sitting for a very long time, for example, if you're sitting and watching a TV program, your Fitbit may pick up that you're sleeping, but in fact you're not. So it's not very sensitive for that. And I think there are studies or innovations in the pipeline to make this a more reliable use for doctors as well. I'm quite looking forward to that because I think there'll be a lot of value. Remember, your Fitbit needs to be used on the non-dominant hand. So if you're right-handed, you need to wear your Fitbit on the other hand, or whatever other device you're wearing that sort of monitors or tracks this kind of thing. Don't rely on that specifically as well, and don't be alarmed. If your Fitbit says you slept for 2 hours, it may mean that you've had 2 hours of sleep since your Fitbit last updated itself, or that you woke up 2 hours ago and then you fell off to sleep. So the last cycle of sleep or the last session of sleep was just 2 hours. So don't be alarmed by that. What medications would someone use? I'm going to come to this because I think many people are worried about sleep medications, or they overthink it, or sometimes maybe perhaps even a bit too free to use it. So sedatives, which are prescribed purely for sleep and are meant as a sedative for sleeping, these usually need a prescription. So things like Rivotril, Ativan, Dormonoct, Urbanol, Valium, these are lovely. These can be used wonderfully in short term, but with care and under prescription by a doctor for you. Like I said, not your cousins or not your neighbors. Using it longer term can result in tolerance, meaning the same levels of medication are not going to have the same effect, and can result in addiction. We get something called rebound insomnia, where eventually you won't be sleeping because you're not getting the medication. And then you take the medication and convince yourself that you've slept because of it, but you're actually having rebound insomnia, whereas the original insomnia or the original reason for the insomnia is long gone. So be very, very careful. If you're using something addictive for longer than 4 weeks or 6 weeks, I would advise use with care under the instruction of a doctor. Antihistamines, this is a nice, useful thing to use if you've got it at home. It's a useful side effect. It's not designed to be used as a sedative. But if you're in a pinch and you really, really can't sleep and you're not going to get to your doctor before a few days, an Allergex is not the worst thing you could be taking. So if you're using it longer term, you can gain weight. So please don't use it or self-prescribe, but it is a good short-term fix. A doctor may also prescribe an antidepressant that has a side effect of sedation, or an antipsychotic. Most people get very alarmed when they hear that they're on an antipsychotic. It doesn't mean that they're psychotic or that they're depressed. It means the doctor's looking for less addictive or less tolerant mechanisms of sedation. An antidepressant is particularly useful when there's mood and anxiety symptoms, because it's a sort of an all-in-one, where you're treating mood, anxiety, and insomnia at the same time. And then light therapy, which mimics natural sunlight, and that's for the daytime. And then for the nighttime, obviously, we're hoping that your brain will switch off enough to help you sleep as well. Not something we often use in South Africa. So that was nice, short and sweet. And I'm going to open the floor now for questions. I see there are a few, so I'm going to look at them. If there's any more, please keep them coming. I tried not to go into too much of detail because I think this was meant to be more, what can you do about this at home? The first question is from Alia, and she's asking, what is the needed amount of time, the amount of sleep for teens? So that is a little bit of a difficult question. Teens generally sleep more, but they can also have the usual 8 hours of sleep. But their sleep cycle's a bit off. So teenagers find themselves naturally being more active and alert at night, and then struggling to wake up in the morning. That's not an unusual sleep cycle for a teenager. So if you've got a teenager in the house and on a Saturday they can't get up before 10, it doesn't mean anything. It just means that this is where they are. This is the amount of sleep or the sleep cycle that teenagers have. So they may need up to 10 hours, depending how old your teen is and what their work and school commitments are. But I know teenagers can survive on less, though I would encourage, at least on the weekends, getting a solid 10 hours on a Friday and a Saturday night. How do you know if you've got insomnia? Well, if you're struggling to fall off to sleep, struggling to stay asleep, or up in the middle of the night and actually can't go back to sleep, and you're one of those people that do need more hours of sleep than you're getting, and it must be affecting your daytime level of functioning, that's how you will know you have insomnia. There's some nice questionnaires online, and you can have a look at that and answer a few questions. They usually have a scale as well that you can scale yourself and see whether you've got a mild insomnia, moderate insomnia, or severe insomnia. And then I've got another question. I've had insomnia since puberty and I've been diagnosed with lupus, but had it in remission for 13 years. My mom had insomnia, also tried so many things, nothing seems to help. So here, obviously, the lupus may be playing or having an effect, playing a role here. I think what's important to consider is, do you need if you feel like you're short of sleep, then you need to do something about this. But if you're someone who just naturally sleeps for 6 hours at night and then maybe needs a daytime top up of 2 hours, and that's how you must try and fit that into your lifestyle. Nothing seems to help. I think I suggest speak to a doctor, and if failing that, go and see a psychiatrist or go and see a neurologist. And they are also sleep physiologists who try and assist you with sleep. So if you've never had a sleep study done, I suggest maybe you do that. What happened over COVID, and I know this is unrelated to the topic of the lupus or the chronic illness, what happened over COVID, because we weren't going to work in the mornings, we all had the chance to sleep in, and then there was nowhere to rush. So at night we'd be wide awake till whatever time. COVID threw all our sleep cycles off. And what happened around that time is sleep studies became more relevant because COVID forced a lot of things to start happening online or at home. So sleep study is actually something, if you can get it motivated for, if you've got the funding, you can contact the nearest sleep lab to come into a study in your own home, in your own bed for the night. And that way they can pick up where the issues are. Are you going into a light sleep? Are you not going into a deeper level of sleep? Are you spending too much time trying to fall off to sleep? So a few answers can be had from there. Also, if your medical illness is causing you not to fall off to sleep, it may pick that up. So for example, if your airways aren't open properly, or if your muscles are moving too much, maybe because of lupus or because of the lupus medication, that can be picked up on a sleep study. Another question, I'm one of the rare people who stay awake even after taking Allergex and in hospital after taking a prescribed sedative. So there can be several reasons for this. And one of that then is that you're having an odd reaction. Now, it's not as uncommon as you think. Some people have a rebound reaction, or they have an opposite reaction of what's expected. And this often happens in older people, that stuff that used to work for them previously now suddenly has the opposite reaction. And even a prescribed sedative may give you an opposite reaction. You can become actually quite agitated on it. If you've been taking medication for a very long time, you may have developed tolerance to it. And so the amount that's been given to you is not enough. On the other hand, you may just have a genetic adverse effect. You can find the right medication for you, but I'd actually, in your case, look at seeing if you can treat other causes and good sleep behavior. That may be half the journey here. There are many, many options for sleep as well. And maybe the option for you here is not a sedative per se, but perhaps something that will work on your lupus as well as have the side effect of sedation. Somebody else posts, I haven't been sleeping for months now. What is your advice? Well, I've given quite a bit of other things or other options on this talk already. Try those if you've done those and they've not worked. And many people try one thing. They'll say, I've been on magnesium for months. Okay, but what do you do when you go to bed? Well, I watch TV till I fall off to sleep. So I think you've learned enough about good sleep hygiene to know that all of this needs to work, or you need to be doing all of this at the same time for a longer period of time before you can say it doesn't work. If it's still not working, then definitely do go and see your doctor, because they can prescribe stuff that will get you back to sleeping healthy, even if it's a temporary medication that you can stop using after a while, and hopefully the sleep habits stay. Another question, is there a melatonin supplement that you can recommend, or is a prescription needed? Melatonin used to be something that was available over the counter. And then because of the varying amounts of melatonin out there, and some of them weren't even at effective doses, the South African Council decided to actually have them scripted. You can get a melatonin SR at 3 milligrams. You can get this at any of the pharmacies. You can get Circadian, but this needs to be doctor prescribed. Or you could go to your natural pharmacy and ask them for a melatonin equivalent of 3 milligrams, and they will give you specifically that. I do know that the ones that are not scheduled or not prescribed are about half the price of the ones the doctor can prescribe for you. Another question, please advise on safe option or remedies for breastfeeding moms. So the antihistamine is a good short-term option. So you can speak to your GP, but I would not advise you to just take this on your own. Speak to your GP or to your gynae about prescribing Allergex or a form of Allergex like Phenergan as well. And if you really, really have tried both of those and they're not working, I often use Trapeline in low doses in pregnant moms or breastfeeding moms. And there is no medication that does not go through your breast milk, but the amount that goes through is important. So something like tretinoin, minimal amounts will go through into your breast milk, and baby will be exposed to but minimal amounts. So you shouldn't have any long-term issues. In fact, both you and baby should sleep a bit better after that. But this is best. I think it's best that you actually speak to someone before trying to use this on your own at home. Can heart meds be causing my mom's insomnia? Definitely, there are significant heart medications, especially antihypertensives, that can be aggravating insomnia. So you take the medication with you to your GP who's prescribing it, or you can actually look online, it will tell you. So side effects are listed in order of occurrence or frequency. So if you Google a medication, not that I'm advising any of you to become Google doctors, but if you Google a medication and it's in the top 10 of the side effects, that means it's quite frequent or quite a possibility that that's the one. So do have a look at the medication that your mom's on and just see if one of them could be the culprit. And often just the timing, changing the timing of the dose may be the answer. You don't have to change the whole medication. You can just change what time your mom's taking the medication, and it may make a difference. Any suggestions? Another question, any suggestions for one who is diagnosed with autism, an adult, and insomnia? I find often the natural things like melatonin work very well in patients with autism or with brain changes. So something like melatonin, a low dose of tretinoin. But again, whoever's diagnosed who is treating the illness would be able to give you something for that. But any of these home things or supplements that I've mentioned, one of the things I have not mentioned is a weighted blanket. So if you haven't heard of one, Google it. There's actually a lady in Cape Town that makes them to your size. So they have tiny glass beads. People get alarmed when they hear glass beads because they think that it will break or it will scratch, but it won't. It's a weighted blanket that just sort of tucks you in. It weights you down. So any inclination to restless legs that you have will be less. It just calms you. So it gives you that sensory stimulus. So someone who's got ADHD or autism, the weighted blanket may make a huge difference. They're quite pricey, but they're well worth it. They can work very, very well. Someone's asked, are there any good natural remedies that work well for insomnia, and what is lupus? So I've mentioned a few of the home remedies that you can try. Magnesium, glycine, lavender oil that you can either burn or keep on your drops on your pillow, and then you can try. So I know on the market there are things like Better Sleep or Viral or Rescue Remedy. You know, the thing is there's so many formulations out there that it would be difficult for me to tell you which one works. Also, none of these are subjected to studies or stringent rules and regulations. My philosophy towards these things, as long as it works for you, then carry on using it. I don't have a for or against for any of these supplements that are sold at the natural aisles, though there are a few tried and tested, like I've mentioned, the magnesium, the glycine. Can insomnia be a side symptom of a more serious illness or psychosis? Definitely. So insomnia is one of the more frequent symptoms in anxiety disorders, in mood disorders, both depression and bipolar or mania, and definitely a side effect or a symptom of a psychosis. Definitely, it's one of the things we look for. Can insomnia lead to psychosis or serious psychotic illnesses? Sleep deprivation, yes. And not having had enough sleep can really aggravate or lower your threshold for experiencing a break. So if you're someone, so it can't give you psychosis. If you've never had a risk factor for psychosis, you can't suddenly become psychotic because you've not had sleep. The risk factor or the risk for psychosis must already be there. So someone who's got a gene or a genetic risk towards having a psychotic illness should not be having sleep deprivation or using large amounts of cannabis or alcohol. All of those things can reduce your risk of having the first expressive episode. Is there a relationship between post-traumatic stress disorder and insomnia? Definitely. That's one of the symptoms that we look for. Remember, post-traumatic stress is an aggravation of your adrenergic system. So you go into fight or flight response, you have this massive adrenergic or shock response, and the function of that response is to keep you alive. So what happens when you've experienced a major trauma, your brain tells you that you are still at risk, and therefore you should either stay and fight the problem, run or play dead, freeze, and the adrenergic response is difficult to switch off. So patients who have PTSD would have things like hypervigilance, so more stimulated, wide awake. They have nightmares, they have flashbacks of the incident. and they have anxiety that's related to the incident, and they have avoidance behavior. So insomnia is a key feature of a hyperadrenergic response. So in people who suffer with any cause of anxiety could have insomnia as well. Are there sleep disorder tests? Yes. And in the bigger centers like Johannesburg and Cape Town, you can have them. Most hospitals actually run a sleep clinic nowadays. So places like Linksfield or Sunninghill, like I said, you can actually call them. It's usually run by a neurophysiologist, someone who has studied neurology and physiology, and they know how to make sense or how to run the sleep tests. And it's usually an overnight test. So they will attach these machines to you. Wires, they look like an EEG actually. So you've got little leads, nothing invasive. They don't poke you anyway. And they run wires running from your brain and some areas of your body to what looks like a Walkman. So the older people on the group will know what a Walkman looks like, and you attach that somewhere, or you leave it in your bed. And what's nice about it these days, it can be done in your home, in your own bed. So no longer having to lie in a strange hospital bed, having anxiety about being in a strange bed and having that test done, because those tests wouldn't be very accurate. But we don't need those to make a diagnosis of insomnia. In fact, we often don't do that unless the patient's already admitted or having a problem with the medication we're prescribing. So another a person has asked, I've tried many meds, but still not sleeping for months, nothing works. Often when a patient has tried everything, I actually tell them, let's go for the big guns. Because what happens is insomnia breeds insomnia. It's like anxiety breeds anxiety. When you're anxious, you're more stressed, and that makes you more anxious and more stressed. So it's a vicious cycle that you're in, and we need to tap into that. So going to get something from a doctor that was going to make you sleep, just two nights of sleeping well will actually break that cycle of insomnia. And you should find that just after a few days of sleeping well, your body may have a more natural ability to fall asleep by itself and not need medication. So not everyone who has insomnia needs to be on heavy medication. But at this point, if you're not sleeping for months, I do suggest that you go and speak to someone or up your level of inquiries. If you've been to your GP and you've tried what the GP has, and then ask the GP for the next step or the next level. Are there mental exercises to help sleep? Definitely. I'd be lying if I tell you I know all the answers, but some of these apps have really nice things. They give you meditation, they give you noises or video or an audio clip that you need to listen to. There's actually an app that plays you someone reading the most boring thing you've ever heard so that you're actually bored to sleep. And trust me, it does work. And there are others that you can listen to something. So if you've got, perhaps if the Quran soothes you, play the Quran on low volume, and just so that it calms you and soothes you. Obviously, don't do something that's going to make you more anxious. If you're the kind of person who wants to know what happens at the end of the story, even if it's a boring story, you'll stay awake till you hear the end. So don't do something like that. So definitely mental exercises. There's something called a script as well. There are actually lots of scripts, but there's something that you can do where you read in your own voice, a voice note to yourself, doing something that's boring and gets progressively more boring, and you play that on repeat and then listen to yourself. So there's definitely a lot of mental exercises. Google some of them and try, but stick to one. Don't overdo it. Don't download 10 exercises and expect to do all 10, because in the process of trying to be particular about all of them, you'll actually create more anxiety. Another question is melatonin safe for breastfeeding? 3 milligrams. I would not advise melatonin for being pregnant, for during pregnancy or for breastfeeding. It is a hormone. At the end of the day, even though it's your body's own natural hormone, I don't advise it for pregnancy or breastfeeding, because ultimately it is going to be passed on to the baby as well. I think there are other things that we know better what they do during breastfeeding. There's a question, do I offer private consultation for sleep deprivation? Not specifically for sleep deprivation. I am a psychiatrist, so I do mood and mental disorders or mental symptoms, illnesses. So if sleep deprivation is your primary problem, I would actually suggest you start with your GP first, try a few things with the GP, who then can decide whether you need a psychologist, a psychiatrist, or a neurologist. Though my details are available on Google if you want them, and if you'd like to make an appointment to come and see me for that, I just still don't think a psychiatrist should be your first line of contact. Is it possible that my insomnia or sleep deprivation could be causing my anxiety, or my anxiety causes my insomnia? And if so, should I go to a psychologist? Yes. So anxiety causes insomnia, insomnia causes anxiety, or rather mood changes in the day the next day. So if you're not sleeping and you're wondering, or you haven't slept and you're wondering how you're going to get through your day, or you go to bed and feeling anxious and that's going to make you not sleep, and so on and so on. You can definitely learn measures or learn things that you can do to reduce your anxiety. Just by treating your anxiety, that should make a huge difference in your quality of life. And therefore, as a byproduct of that, you should have better sleep. So definitely, I do recommend learning to treat your anxiety better. If you feel you need to see a psychologist, by all means do that. Talk therapy certainly does help. And I think, like I've suggested, try some of the home remedies first, including behavioral changes before heading for medication. Another question, do I recommend a serotonin supplement? You know, this is such a hot topic. I get patients who come from GPs or from other natural doctors, and they'll come and say to me, I'm on this supplement. Why do I need something from you for serotonin? So the serotonin that causes the changes in your mood or anxiety levels is a serotonin that's surrounding your brain and your spinal cord. So it's in your cerebrospinal fluid. When these doctors check your serotonin levels, they're checking the serotonin in your bloodstream. Those are two different things. We have lots of serotonin in our bodies. We've got serotonin in our gut. In fact, a large part of our gut have got serotonin receptors in them. So our appetite, our metabolism, a lot of things are governed by serotonin. Therefore, for those of you on this group who have experienced irritable bowel, they will know the irritable bowel syndrome or symptoms get worse when they have high levels of anxiety or they're having a bout of depression, because the serotonin receptors are being overstimulated. A serotonin supplement is only going to be absorbed by your gut. It's not necessarily going to cross your blood-brain barrier to be effective where it's needed. So I don't recommend a serotonin supplement. I don't test serotonin levels, and there's no psychiatrist I know that does it either, because we simply do not think that serotonin in your blood is what's going to be responsible or is responsible for serotonin that's causing mood and anxiety symptoms. So do I recommend a serotonin supplement? No, but like a lot of things, if you feel it's going to work for you, it probably will. I particularly personally don't. Are there any brain scans that can be done to give an indication on whether someone suffers for depression? There is functional brain scanning, PET scans and SPECT scans that can look at areas of abnormality in your brain. However, they're extremely expensive. It's not something I would routinely advise. We make a diagnosis of depression from a clinical perspective. So we would ask you questions. Remember, it depends on what you're experiencing. And your doctor's simply not going to ask you, are you depressed? For most people, they don't even know what a cluster or what depression looks like. For most people who come in, the diagnosis of depression is one that's made because of something else they're experiencing. So they'll say things like, I'm irritable. I find myself very short-tempered. I'm not sleeping at night. I've had a flare-up of my IBS, or my blood pressure is sky high. And then we ask all the questions around, and therefore then we come to a diagnosis sometimes of depression. We don't do brain scans to confirm that. And I wouldn't do a brain scan either to check if your medication's working. I would look at you clinically and ask you how you're feeling. And so there are other questions. In fact, our psychiatric history taking takes about an hour, 45 minutes to an hour before we can give you a proper assessment on what's the problem. Could anxiety cause a lack of appetite and mood swings? Definitely. Remember, your behavior and your brain and behavior are part and parcel of the same thing. I also mentioned serotonin receptors in your gut that are also being affected with the serotonin stimulus in your brain. So cause a lack of appetite, yes. So it can cause an increase in appetite, can cause a lack of appetite. I'm specifically referring to any mood disorder here. Can also cause emotional eating. So a lot of people will say, I haven't lost weight, but I hardly eat. Can lower your metabolism. A lot of people will say they eat junk food when they're stressed. So they eat to fill a gap or fill some kind of emptiness, but not because they're hungry, and the same meal doesn't satisfy them. They don't feel like they ate a good meal or they feel happy after they've eaten. Mood swings, definitely. So we call it mood lability, which means the mood can go in either direction. You may find yourself having lows where you're feeling sad and tearful for no reason, or you may be irritable or aggravated or even unusually happy for a short period of time. That would be considered mood swings, where these mood swings take place over a matter of hours. Would I consider doing a webinar on stress, anxiety, and depression? Thank you for asking. We've had one. It should be available on YouTube. I did this one last year sometime, specifically on stress and anxiety. And I'm sure that Muslims Connected will host another one this year sometime. So keep a watch on this space. Another question. Nutritionists and psychiatrists recommend some food and drinks to increase serotonin. So how is this different than supplements? Sure, the nutritionists may be suggesting it. And like I said, personally, I don't know any psychiatrists who are telling patients to increase food that's rich in serotonin. I do know food rich in anything that may be considered a shortage in your body may be helpful for you. But if you come in and tell me I'm depressed, I'm not going to say eat a lot of bananas, you should be fine. So, maybe I'm looking at it from a different point of view. Is by the time you're having symptoms that are ongoing and you're needing to see a psychiatrist, we're beyond the point where supplements or food intake of that supplement or that neurotransmitter may be helpful for you. So no, I'm still not of the opinion that you can go to the counter at Discam and ask for a serotonin supplement and then you'll feel a lot happier. Do I think it can be harmful? No, I don't think it will be harmful. So again, if it's something that you feel will make a difference for you, please, by all means, take it. I find a lot of people stay away from medication from a psychiatrist. I'm not sure why, because they feel the medication may be expensive. And I can tell you now, these supplements are not any cheaper. You can pay 400-500 Rand for this. And we have antidepressants. Not that I'm in any way advocating for antidepressants, but you can get an antidepressant, a generic of Prozac for 20 Rand. So I'm just saying, be clear on what your reasoning is for not wanting to be on medication. Why do antihistamines or antidepressants cause weight gain? So a lot of the antidepressants work on more than one neurotransmitter system in your body or in your brain. And antihistamines and antidepressants both work on histaminergic systems or neurotransmitters in your brain, which in the long term will cause weight gain. It will reduce your metabolism and cause weight gain. So the antidepressant and the antihistamine causes might be slightly different in terms of their mechanism of action, but they both can cause weight gain. I always tell patients that when they come in and say, I've picked up some weight on some medications, we always talk about a risk-benefit ratio. And what I mean by that is the risks of gaining weight on the medication versus the benefit of the medication. Remember, someone who comes to see me for the first time is usually quite ill and unwell and desperate as well for medication to work. So if I start you on medication and then you come to me 3 months later and you're in a much better mental space, then it's easier for me to change to medications that have less side effects also, because you're better able to tolerate those medications, or better able to tolerate those side effects. Now I can say, let's change to medications that perhaps don't work as well, but that cause less side effects. Whereas in the first few weeks of coming to see me or first few months, maybe you are far more anxious and I need to get that anxiety under control. For many people who are not exercising or eating badly, just getting the mood lifted, getting the motivation better may be sufficient to kickstart things in the right direction. So you start eating healthier because now you have energy to wake up in the morning and plan your meals for the day instead of popping in at KFC for lunch. You have more motivation to go to the gym after work or during your day because your mood is better. So I always say we need to talk about this. It's not just here's medication and you're going to get fat. No, it's here's something that's going to help with your anxiety or your depression. And now you start feeling better. And now we have more options to worry about possible weight gain. Another question, they say chocolate or almond increase serotonin and improve depression, for example. Sure, chocolate's very nice. I won't, disagree with that. But if you're having a depressive episode, am I going to prescribe you a golden ticket to Willy Wonka's chocolate factory? No. Willy Wonka is actually a case in point. He was actually quite a depressed person himself, but obviously he's a fictional character. Chocolate and almonds, yes, very helpful in the moment, but not going to have any lasting effects. How many almonds would you need to eat to treat a depression? I've never even considered that as an option. So just saying, if in the moment you're looking for a decent snack, a piece of chocolate, obviously the healthy dark chocolate with less sugar is not a bad option, and a handful of almonds, as we know, is also sunnah. Could I use serotonin for anxiety and depression? I think I have answered this question about 4 or 5 times already, but I am going to say this. Most antidepressants, the mechanism of action was thought to have been, one of the mechanisms of action was thought to have been because it increases the serotonin in your neurotransmitter synapses, where the two neurons meet. So serotonin is one of the neurotransmitters that are believed to be low when you're depressed. And adrenaline is believed to be high when you're anxious. So the modern day antidepressants, as we use them, and I'll give you some examples, would be things like Lexamil or Prozac or Venlo or Brintellix. Most of them work on serotonin and indirectly on noradrenaline. So what they do is they block your serotonin reuptake inhibitors from uptaking the serotonin. So it's like me stopping something from being picked up, so that will accumulate. And so your own body's serotonin will start to accumulate and be reused and reused in that same neuron connection, and therefore will have a positive effect on the neurons around it. The second part of that is that eventually the high amounts of serotonin transmission will actually reduce or have a negative impact on adrenergic transmission. So the same antidepressants that will lift your mood initially will lower your anxiety at a later point. So it's a longer term effect, but it will lower your anxiety. So therefore, when you go and see a doctor, the same things you're using for depression, or you'll hear that someone else with anxiety was treated with the same medication. So yes, recently there was a huge outcry that serotonin was found to not be or antidepressants, a low serotonin is not the cause of anxiety or depression. It's only one of the things. There are like so many neurotransmitters in your brain. We're not fully sure exactly what all of the medications do to all of these neurotransmitters. It's not yet possible to know that, but perhaps there's another mechanism of action. What I do know is that this does make a difference. It's not everybody's first solution, but it certainly makes a difference. I'm not sure if there are any other questions. I hope I've answered that appropriately.
There are some questions in the chat box, if you don't mind going through them.
Let me have a look. I'm only checking on the question and answer here. Let me check on the chat. All right. Sorry, I'm going to go back all the way up. Okay. So one of the questions on the chat, my mom is on chronic meds, namely Ramprol, Carlox, Simvastatin, Spirectin, and a blood thinner. Could one of these be causing her insomnia? Yes, but I'm not going to go into specifically which one. There looks to be at least one culprit here already. I would suggest you go and see the doctor and go through the medications and ask which ones can be adjusted. And like I mentioned earlier, they need not be stopped. If she's stable in terms of her medical illnesses, her blood pressure, her heart, all of that is stable on these meds, perhaps just an adjustment of the dose timing could make a difference here. Somebody else has asked, I don't sleep much, but I take long to fall asleep. I'm assuming that the problem also is that you're not having sufficient sleep then. So the taking long to sleep, there are things that you could do to try and reduce that. And I hope some of the tips that I've given or some of the things that we've discussed tonight can help with the falling off to sleep faster. So please do try those. Otherwise, the doctor can give you something that will work in the short term. So something that takes 15, 20, 30 minutes at most to kick in that will help you to fall asleep quicker. There are other medications depending on the duration or the mechanism of action that actually don't work so fast. So for people who don't struggle to fall off to sleep, but struggle to stay asleep, then we've got medication that has a longer duration of action that will be there to help you stay asleep. Can insomnia be a side effect or side symptom for another illness? Can you give examples? Definitely, many neurological illnesses have insomnia as a side or an additional symptom. Epilepsy is one of them, restless legs, tic disorders, gastrointestinal symptoms, so IBS will be something that will keep you awake, heartburn, people who are overweight, thyroid may have a side effect of insomnia. So there's a few things. Another person mentions, I don't sleep, not much, 2 hours of sleep, wake up, sometimes takes up to 3 hours to fall asleep again. So for me, this would be someone who has middle insomnia. So you fall off to sleep fairly easily, but then you don't sleep fast asleep through the night. So here you may be looking at something like magnesium longer term, or even melatonin to just help you to access that deeper level of sleep from which it's not easy to just be awake again. Also, you may want to look at and consider that you may have anxiety symptoms that are, once you're awake, your brain starts working again. Are there doctors who specialize in sleep disorders, and are there tests for sleep disorder? The tests I mentioned, most of them, it's a clinical diagnosis. So a doctor would ask you a set of questions and you would answer those, and therefore diagnosis of insomnia would be made. Sleep tests, we talked about a polysomnogram, and that will figure out exactly where in your sleep cycle there's a problem, whether it's in your falling off to sleep, whether it's your heart that's not sufficiently slowing down, or if it's your muscles that are not as relaxed as they should be, or if it's your brain. Then also they look at the levels of sleep, whether you're just in that light phase of sleep, or if you're accessing deeper levels of sleep and unable to sustain those. So definitely there are tests for sleep disorder. Doctors who specialize in sleep disorder, there are sleep physiologists. You can find out, depending which city you're in, you can Google for those. And there are sleep clinics who would run a sleep study, even if it's not, you don't have a sleep specialist who is going to be looking at it. Though, if you want medical aid to fund for it, you may need to go the process, which is from your GP to be referred to a sleep specialist, which would be a physiologist, psychiatrist, or neurologist, and therefore they can then ask for the test to be done. Another question, if drinking green tea, should the last cup also be 4 p.m.? Well, I think it depends on why you're drinking green tea. So if you're drinking green tea because you want to lose weight, I suggest getting it in like you would get in your coffee, which would be the last cup at 4 p.m. I know people who drink coffee at 4 p.m. and still can't sleep at night. So don't take my word for it. This is just a generic suggestion. And then I also know people who can drink coffee at 10 p.m. and go straight to bed after that. So you need to cut it out for a few days, or make the time earlier for your last cup, and then see what difference that has on you. Green tea has a lot of caffeine. People underestimate, and they think because it's natural and it's healthy, which it is, by the way, but it's healthy, that it has no side effects. But certainly insomnia and aggravation of anxiety is one of them. Another question, I fall off to sleep but always awake after 2 or 3 hours between 1 or 2 a.m. I have read about some organ function affecting sleep. This again is middle insomnia. And again, you need to be looking at things like, am I breathing appropriately? Am I getting enough oxygen in, or am I getting enough carbon dioxide out? Do I have restless legs? I think I've answered this with the previous one, but certainly cardiac issues, lung functions, or lung issues may also cause problems with sleep. Can insomnia lead to more serious psychotic disorders? Also have answered this question before. It can certainly aggravate an expression or relapse in that disorder. It can't give you. So if you've never had schizophrenia in your life, you can't suddenly get schizophrenia because you haven't slept. But if you were at risk of having schizophrenia, then it's quite likely that this would be a risk factor for unmasking an underlying schizophrenia disorder. The same thing with bipolar. If you have high risk for bipolar, your auntie's had it, or your mom or your grandmother, or you've just recently been pregnant and now you haven't slept for 2 or 3 days, there's a high possibility of you unmasking or developing a manic or hypomanic episode because of the sleep deprivation, but it won't give you bipolar. Someone's mentioned, I'm on MedPlus Zolpidem, doesn't always work as I tend to wake up or have difficulty falling asleep. I've got a chronic nasal drip and struggling with switching off my mind. So need something to get some sleep to function. Normally is 3 to max 6 hours. Okay, so the Zolpidem that you're on is short acting. So it works within 15 to 20 minutes. And you've mentioned struggling with switching off my mind. So definitely the Zolpidem is going to help you switch off your mind. But it only works for 4 or 5 hours, between 4 to 6 hours. In fact, if you take the whole tablet, it will work for maybe 6 or 7 hours. The problem with Zolpidem is it was developed to be the more modern cousin of the benzodiazepines. So it's the more modern version of Ativan and Valium and Dormonox and all those things. The problem is that it can be addictive. So you'll find yourself, even when you're not using it, that you feel like you need to use it, or you need to use more of it. You develop tolerance as well. So you're eventually going to find that the amount you've been using doesn't have the same effect as it did when you first started. What I find very useful with Zolpidem is to actually keep it intermittent. And what I mean by that, don't use it every night. So alternate that with something else that you have used that does work. So if you take the Zolpidem Monday, Wednesday, Friday, and on the other days of the week, you use something else, the Zolpidem will continue to work. On the other hand, if you're using Zolpidem longer term, use it for 4 to 6 weeks, stop, use something else altogether. When you restart the Zolpidem, it will work like it worked the first few times you used it. So I hope that helps you a little bit. I suggest you also have your chronic nasal drip seen to, because that could be quite an aggravating factor in keeping you asleep. Because remember, the zolpidem is getting you to sleep faster, and it's reducing your brain from picking up or being awakened by this nasal drip. And now when it wears off, the drip is waking you up and then you can't sleep again. I do suggest you maybe speak to someone who's a bit more experienced with sleep, if they can give you something else that you can alternate instead of just using zolpidem the whole time. I can guarantee you the zolpidem is probably not working the way it did initially for you. What do I think of Xanax? Xanax falls into the category of Ativan and Rivotril and benzos. It's part of the family of benzos. Very useful. Lower dose can be used for anxiety during the daytime. So if you have high levels of anxiety or you feel like you're going to have a panic attack, the Xanax will work quite well, and higher doses will be used to take away or to sedate you at night. I mentioned the whole thing about zolpidem. The Xanax is even worse than that. You will develop tolerance to the Xanax, so the same amount of Xanax is not going to have the same effect, and you will be addicted to it, meaning when you don't take the Xanax, you actually will have a withdrawal syndrome, which mimics anxiety and insomnia. So you may still think you're having anxiety and insomnia, whereas that is now the withdrawal from the Xanax, which has now created a bigger problem. Short term, great for use. Don't use it longer term. And by longer term, I mean 6 weeks onwards. Please don't be using it. How did you say we can reduce noise by blocking the room? Thick curtains, shut your door, reduce. You can have white noise, have a fan on or an air conditioner. If you've got a generator right outside your window, that would be noise just outside your room. If you've got noisy people in your area or around your house, try and just reduce that as well. So these are things you just need to do for yourself. If you particularly in a noisy area of your house, maybe move your bedroom, but certainly you can do just physical things that you can shut down or start to eliminate for yourself. Like if there's a TV in your bedroom, take it out. If your husband's watching TikTok videos in the bed next to you, kick him out till he's ready to come back without his phone in his hand. So I say this lightly, but I think you understand what I'm trying to get at. Do you have any thoughts on dry mouth? I drink a lot of water and I get up from my sleep to use the bathroom frequently. Look, the dry mouth could be due to a multitude of things. Are you dehydrated? Are you drinking a lot of water during the day? Are you drinking sufficient water during the day? On the other hand, you may be taking medications that are giving you a dry mouth. So something to consider. If you have to drink a lot of water to keep hydrated, remember, thirst is your body's way of telling you that there's something wrong. If the getting up and going to the bathroom frequently is disturbing your sleep, then I suggest you look at what I've discussed or what I've said about the dry mouth. What could be causing it and what can you do to reduce it? There isn't much you can do to reduce unless it's being caused by something else. If you are able to fall off to sleep as soon as you come back from the bathroom, then I don't see that there would be a problem. In fact, then it's just something you've learned to live with or you will learn to live with. But I suggest you have a look and see if there's something causing the dry mouth specifically. Have I found in my practice insomnia caused by gene possession? Definitely. And I think it's important that psychiatrists realize that there are many things we are not trained to be looking at. Also, I find it useful to be working in conjunction with appropriately trained alim and people who are trained to manage gene possession. If I recognize that or I see it, or if a patient tells me they think they've been possessed by a gene, I would refer on and actually work hand in hand with someone who's trained. So often I find that getting a patient contained, meaning they're calmer, they're less agitated, they're more likely to take the instructions by an alim that's going to manage the gene possession. So if you're going to see an alim and you are aggressive and violent, even the alim can't always get you to be to that point of cooperation that is necessary. Sometimes I refer on and that's it. Patients don't come back to see me. They're not my patient, shouldn't have come to see me in the first place. But often we do work hand in hand. And I sometimes do get referrals from appropriately trained, Molanas or alims will say, this is not for me. I've checked, this is not something that I can work with. This is a biological or a chemical problem. And as a psychiatrist, can you assess? So definitely we are more sensitive and aware of that kind of condition. A question, can I recommend a natural melatonin supplement that one can get without a script? Certainly you can go to your wellness pharmacies, your homeopathic pharmacies and ask for a melatonin supplement. There are many, but the homeopath would be someone who would be better trained to tell you exactly which one would work. Like I said, the minimum active amount of melatonin is 3 milligrams. So as long as you get 3 milligrams of melatonin in that supplement, I think you have very good ones out there. There are good ones out there. So I see the recording has been, the session has been recorded and shared. How to treat fibromyalgia causing insomnia. And the question is specifically, so I'm taking it, this is a question from someone who has had medication or is a doctor or psychiatrist or mental health practitioner. SSRIs, SNRIs, or NDRIs best for insomnia? So this specifically refers to the mechanism of action, and the SSRIs are selective serotonin reuptake inhibitors. SNRIs are serotonin noradrenaline reuptake inhibitors, and the last one is NDRIs, noradrenaline dopamine reuptake inhibitors, best for insomnia. So I think there's two different questions here, because the first one is fibromyalgia. And also fibromyalgia is a chronic physical pain syndrome that the person experiences, having various pain symptoms in various organs of the body, in the reproductive organs, in the gut, in the brain, so neurologically, in the musculoskeletal system as well. That is closely related to depression or mood symptoms and anxiety as well. So the most primary cause of treating the insomnia would actually be treating the underlying pain and the depression and anxiety. What's nice for fibromyalgia is actually an SNRI, because it's more activating. So it treats the serotonin, which is the mood. It also treats the adrenaline, or reduces the noradrenaline, which is for anxiety. And there's one specifically called duloxetine, which we use as first line. But like I'm saying, if you're not treating the pain appropriately, you can give all the medications in the world, but if you're not treating pain itself is going to aggravate mood and anxiety. And SNRI, however, will treat mood and anxiety. It won't treat specifically the insomnia. I wouldn't use any of these SSRIs, SNRIs, or NDRIs for insomnia. In fact, a few of them will aggravate your insomnia. So now I wouldn't use any of those specifically for insomnia. What I would do is treat mood and anxiety with those. And if I still need something for insomnia, I would treat that separately. Or we use medications like trazodone or mirtazapine, which actually does have a sedative side effect in addition to the mood and anxiety component. I think for most of the lay people on this group, that would be a little bit of a complicated, and I don't want to go into more detail than that. Another question, do I provide therapy online for international patients? I do online sessions, but remember, we need to be registered in the country that our patient is based in. So if you're South African and temporarily based overseas, we can do a consultation, though I don't think that's my first suggestion for you. I always suggest to perhaps get to see someone face-to-face first, particularly for therapy. I am probably not the most qualified for therapy. I'm a psychiatrist, which is a medical doctor, and I actually recommend that you see a therapist if you're looking for therapy. I do, however, do consultations for South Africans, especially if they're based overseas for a short while. I don't think there are any other questions, Vasvia.
There's just two more in the Q&A, but we are over time, so I actually want us to rather stop now, if that's okay. I'm sorry to those who we did not get your questions. Please make sure you get your questions in earlier next time around. So we will end over here. And shukran so much to Dr. Feroza Arbee for sharing your time and your expertise with us. We really, really appreciate it. And, you really take your time to answer everyone's questions and to go into detail, which is really, really special, alhamdulillah. So we ask Allah subhanahu wa ta'ala to reward you abundantly and to protect you and your family. And we ask everyone watching to also make dua for you and your family and your practice. And Allah, grant shifa to all of those who are suffering from insomnia and all other mental and physical ailments as well. Ameen, Ya Rabbil Alameen. To our everyone watching, please help Muslims Connected by subscribing to our YouTube channel and to go and follow us on Instagram as well as on Facebook. And please like and share our content. And to those asking about the recording of today's session, it will be uploaded on our YouTube channel. So please go and check us out on YouTube. It is simply Muslims Connected. So once again, shukran so much to Dr. Feroza Arbee and for everyone for being here with us today. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah, Wasfiya, for having me, and Ameen to all your duas. Assalamu alaikum.